Hello, and thank you so very much for joining me today. If you are a woman who is navigating the rich and complex journey of life in your 60s or beyond, I want you to know that what we are about to discuss together could very well be one of the most significant and potentially life-altering conversations you will have all year, especially when it comes to the intricate and delicate interplay between your body, your vitality, and your profound emotional health. My name is DrLilyStones. I am a board-certified physician, and I have dedicated more than 3 decades of my professional life to the deeply rewarding practice of caring for women just like you. And today we are going to talk about something that, for far too long, has been kept in the shadows of our collective discourse. We are going to explore the profound and far-reaching impact of intimacy, and particularly of self-intimacy, on a woman's overall health and well-being as she gracefully ages. Let me begin by sharing a poignant story with you. A few short months ago, I received a heartfelt message from the daughter of a former patient of mine. Her mother's name was Lenina. Throughout the many years I had known her, she had always been an incredibly vibrant, exceptionally sharp, and deeply warm-hearted individual, full of a radiant and infectious zest for life. One morning, her daughter found her peacefully resting in her favorite chair by the window. Her cup of tea was still warm on the table beside her, a piece of knitting lay gently in her lap, and the soft morning sun was illuminating her face. She looked, by all accounts, completely and utterly peaceful. But she was gone. The official cause of death was listed as natural causes. Natural. But as someone who had carefully and compassionately reviewed the gradual and subtle decline in Lenina's health over the preceding years, I saw something else entirely. Lenina's precious vitality had not been stolen from her by a sudden and aggressive illness. Rather, it had slowly, quietly, and insidiously slipped away from her due to many years of what can only be described as a form of profound physiological neglect, especially in the crucial and often overlooked areas of her pelvic and her emotional health. And please understand, Lenina is not alone in this experience. Every single year, thousands upon thousands of older women experience a similar and tragically silent unraveling of their well-being. This does not happen because they are doing something wrong, but because they are being told, either explicitly by outdated societal narratives or implicitly through a pervasive cultural silence, that they are no longer supposed to actively nurture a part of themselves that was once considered to be absolutely vital to their intimate health. For many decades, women have been systematically led to believe that the experience of desire has a definitive and non-negotiable expiration date, that the capacity for pleasure is something that we are simply meant to grow out of as we age. But here is the profound and empowering truth that I so desperately want you to hear today. The act of maintaining a deep and loving connection to your own body through whatever form of healthy, respectful, and mindful self-touch you personally feel comfortable with is not only completely natural, it is, in fact, critically and fundamentally important for your long-term health. This conversation is not about promoting a sense of indulgence or of hedonism. It is about the essential and science-backed practice of preserving your circulation, of maintaining your hormonal balance, and of nurturing your emotional well-being. When a woman ceases to engage in any kind of sexual activity, and this most certainly includes the practice of self-pleasure, especially in the years following the transition of menopause, her body does not simply and passively press a pause button. It begins, in fact, to actively change. The health of her tissues, the delicate balance of her hormone levels, the strength of her muscles, and the stability of her mood can all begin to decline as a direct result of this inactivity. The single most common and heartbreaking thing that I hear in the quiet and confidential space of my office is, "Why did not anyone ever tell me this?" That is precisely why we are here today. In this comprehensive and compassionate video, I will carefully and thoughtfully walk you through 4 of the most well-documented and medically recognized consequences of completely stopping the practice of self-stimulation in your later life, and far more importantly, what you can actively and empoweringly do to prevent them. Please understand, these are not just theories or passing fads. They are deeply rooted in scientific evidence, and they are strongly backed by my many years of direct clinical experience with thousands of women over the age of 60. So, please, I urge you to stay with me until the very end. The last point that I will share with you is perhaps the most emotionally impactful and the least discussed of all, and it may just help you to understand yourself in a completely new and illuminating way. If you are listening to this, and this particular topic is resonating with you on a deep and personal level, I warmly invite you to like this video, to leave a thoughtful comment below, and to subscribe to this channel. At Elderare Wellness, we firmly believe that all women deserve to have honest, compassionate, and empowering conversations, especially when it comes to the beautiful and complex journey of aging. Now, let us begin our exploration with the very first, and often the most overlooked, consequence of this neglect: the gradual and insidious loss of your vaginal and clitoral function. Consequence 81N. The gradual loss of vaginal and clitoral function. I want you to take a moment and imagine your muscles. What happens to them when you stop actively using them for a period of several weeks or even months? They inevitably and predictably begin to weaken. They start to lose their tone, and they can even begin to shrink in a process known as atrophy. The very same fundamental and biological concept applies to the delicate and intricate tissues that are located within your pelvic region. Your vaginal walls and your clitoral tissues are both highly vascular and exquisitely sensitive structures. This means that they rely on a consistent and robust flow of blood and on gentle and regular stimulation in order to remain healthy, resilient, and functional. According to both the Mayo Clinic and the North American Menopause Society, two of the most respected authorities in the field of women's health, when these particular tissues go for extended periods of time without the experience of arousal, and this is particularly true in the years following menopause, they can begin to lose their natural elasticity. They can become progressively thinner, and they can produce significantly less of their own natural lubrication. This clinical condition is known as vaginal atrophy, and for a great many women, the very first and most subtle sign of this condition is not a feeling of dryness or of discomfort. It is, in fact, a gradual and often perplexing fading of sensation, a noticeable loss of the capacity for pleasure, and sometimes it can even manifest as a sharp and debilitating pain, either during moments of intimacy or even while you are simply sitting. Please, I implore you to understand, these are not just the unavoidable and inevitable symptoms of getting older. They are clear and direct physical signals from your body that it is in desperate need of your attention and your loving care. I will always recall a dear patient of mine, a woman we will call Carol, who first came to see me at the age of 71. She was visibly and palpably anxious. She shared with me that she had not felt comfortable down there in many, many years. And when she did make an attempt to re-engage with her own body, the experience was both distressing and deeply painful. She had come to believe that there was something fundamentally and irrevocably wrong with her. But Carol was not broken. Her body had simply and intelligently adapted to a state of prolonged disuse. Just as a joint in your body will inevitably stiffen and become less mobile without regular movement, your vaginal and your clitoral tissues will respond to a state of prolonged inactivity by becoming progressively less responsive and less vital. The wonderfully good news is that, in a great many cases, and with a gradual and gentle reintroduction of mindful stimulation, with the consistent use of high-quality vaginal moisturizers, and in some cases, with the guidance of a skilled pelvic floor therapist, your natural sensation can indeed improve. But this is only possible if you are able to catch it in its early stages. What saddened me the most about Carol's story was the sheer number of years that she had spent thinking that this was a normal and unavoidable part of her life, that she just had to silently and stoically accept this profound and painful change. You do not. Even the most light and respectful forms of arousal, practiced just a few times a week, can be instrumental in helping to promote your circulation, to preserve your tissue elasticity, and to maintain the overall health of this incredibly important and vital system. And please know, this does not need to be an elaborate or a complicated practice. A simple, consistent, and loving application of care can make all the difference in the world. Consequence 2I. The disruption of your hormonal landscape. Now, let us talk about something that is even more foundational to your overall health and well-being: your intricate and delicate hormonal landscape. Most people tend to associate significant hormonal changes exclusively with the transition of menopause, and to a certain extent that is fair. The levels of estrogen, of progesterone, and of testosterone all undergo a significant and permanent shift during those transformative years. But what a great many women do not realize is that the experience of intimacy, and especially of orgasm, can have a profound and lasting effect on your hormonal landscape, even for many decades after the cessation of your menstrual cycle. When you experience a state of arousal and a subsequent release, your brain responds by releasing a powerful and beautifully orchestrated blend of various hormones and neurotransmitters. Oxytocin, which is often referred to as the bonding hormone, works to foster deep and profound feelings of calm and of connection. Dopamine, in its turn, serves to boost your mood and your sense of motivation, and endorphins work to effectively reduce both your physical pain and your emotional stress. These remarkable and potent chemicals work together in a perfect and harmonious synergy to create a state of internal balance and of vibrant vitality. Now, I want you to take a moment and imagine going for years and years without ever triggering that beautiful and life-affirming cascade of beneficial chemicals. In my clinical practice, I have met countless women who have come to me complaining of persistent sleeplessness, of a general sense of irritability, of a pervasive feeling of sadness, or of a profound sense of emotional flatness. They had diligently tried a wide variety of supplements. They had made significant changes to their diets, and some of them had even started taking antidepressant medications. But when we took the time to explore their daily lives more deeply and more honestly, one particular and consistent pattern almost always stood out: a complete and total absence of any form of intimacy in their lives. One woman whom I will never forget was a retired school principal. Her voice cracked with a deep and palpable sense of sorrow as she told me, "I just do not feel like me anymore." And the profound truth of the matter is that she was not imagining it. Without the natural and powerful hormonal reset that the experience of arousal can provide, a great many women begin to experience a state of heightened stress, of reduced emotional resilience, and even of increased and more severe symptoms of both depression and anxiety. This does not mean that the experience of pleasure is a cure-all for these complex conditions, but it is, without a single doubt, a powerful and completely natural form of support for your brain's delicate and intricate chemical balance. And it is never, ever too late to reactivate that beautiful and beneficial pathway, whether it is through a process of gentle and curious exploration, through the practice of mindfulness-based intimacy, or through a variety of self-guided and loving practices. You absolutely possess the innate and powerful ability to maintain your own neurochemical wellness. This is not an act of indulgence. It is, in fact, an invaluable medical tool that you carry with you every single day of your life. In Part 2, we will delve even deeper into how your pelvic floor function and your emotional resilience are directly and inextricably tied to your body's own intimate rhythms, and why the act of ignoring them can profoundly affect everything from your bladder control to your very sense of identity. But for now, please take a moment to reflect on this. Consequence N3. The weakening of the pelvic floor. The proper and healthy functioning of your pelvic floor allows you to effectively control your bladder, to have healthy and regular bowel movements, to support your posture, and to enjoy a state of comfortable and pleasurable sexual intimacy. But when this crucial network of muscles begins to weaken, everything from your sense of independence to your very confidence can be profoundly and negatively affected. Here is what most people do not realize: the practice of regular sexual activity, and this most certainly includes the act of self-pleasure, is one of the most natural, most effective, and most accessible ways to keep these incredibly important muscles both engaged and strong. During the experience of an orgasm, your pelvic floor muscles contract in a rhythmic and involuntary fashion. This is, in essence, like a targeted workout for these muscles. Except instead of lifting heavy weights, your body is intelligently and effectively engaging those deep and stabilizing muscles through a process of completely natural movement and reflex. When that regular and consistent stimulation disappears from your life, so too does the invaluable opportunity for those muscles to stay properly toned and functional. I have treated a great many women who first come to see me because of the distressing and often embarrassing issue of bladder leakage. Some of them are in their late 60s, while others are in their 80s. Very often, they have stopped going to their favorite social events, they have given up taking long and enjoyable walks, or they have ceased traveling, all because they are constantly worried about being able to find the nearest bathroom or about experiencing an embarrassing and unexpected accident. They almost always assume that this is just an inevitable and unavoidable part of the aging process. But I am here to tell you that age is not always the root cause of this issue. More often than not, it is a simple matter of muscle disuse. In fact, numerous and extensive studies that have been supported by the National Institutes of Health have conclusively shown that the practice of regular pelvic floor engagement, whether it is through specific and targeted exercises or through the maintenance of a healthy and active sexual function, can significantly help to reduce the risk of developing urinary incontinence and even the more serious condition of pelvic organ prolapse. Let me tell you about a wonderful woman named Joan, a kind and spirited 74-year-old lady whom I treated a few years ago. She was sharp, she was funny, and she absolutely loved doing crossword puzzles. But she had not left her house in over a month. Why? Because every single time she laughed or sneezed, she would experience a small but significant leakage of urine. After a thorough physical exam and a long and compassionate conversation, we came to the realization that her pelvic floor had weakened quite significantly over the years. She had not consciously engaged those crucial muscles in a very long time, not through any form of targeted exercise, and not through any form of intimate stimulation. And she had absolutely no idea that something so deeply private and personal could be so directly and profoundly connected to her everyday sense of freedom. With a personalized and comprehensive program that included specific pelvic floor exercises, a focus on proper hydration, and yes, the gentle and mindful reintroduction of self-intimacy, Joan was able to completely regain her confidence. Within just a few short months, she was once again walking with her friends and was even planning a trip to visit her sister, who lived out of state. You deserve that very same kind of freedom, too. Maintaining the health of your pelvic floor does not mean that you need to follow a strict and punishing regimen or that you must pursue anything that makes you feel uncomfortable. But simply staying connected to your own body in ways that feel good and safe to you is an integral and essential part of keeping your independence, especially as you continue to age. Consequence 24A, the creeping emotional disconnection. Now, I want to shift our focus to something that is even more personal and often more painful. This is something that I have heard whispered in so many private and confidential conversations with my beloved patients over the years. The profound and often devastating emotional disconnection that can slowly and insidiously creep into your life when the experience of intimacy begins to fade. It is often very subtle at first. You may gradually stop engaging with your own body, perhaps because of a sense of physical discomfort or just due to the deeply ingrained and culturally pervasive belief that those particular days are now behind you. You might tell yourself that it is a normal part of life. Your own mother certainly never talked about these kinds of things, and your friends rarely, if ever, bring them up in conversation. And besides, you might think, what would it really change anyway? But over the course of time, that initial sense of disconnect does not remain isolated in just one single part of your life. It begins to spread, and it starts to profoundly and negatively affect how you see and how you feel about yourself. Women have shared with me that they no longer feel feminine, that they begin to actively avoid looking at themselves in mirrors, not out of a sense of vanity, but because something essential and fundamental feels as though it is missing. They describe the painful experience of feeling invisible in the very same rooms that they once used to light up with their presence. They stop laughing as loudly and as freely as they once did. They begin to hesitate before they reach out to others for connection. And more than anything else, they feel deeply and profoundly alone, sometimes even when they are in a house that is full of people they love. There is no laboratory test for this particular condition. It does not show up on any kind of medical scan, but its impact on a woman's life is undeniably and devastatingly real. The experience of intimacy is about so much more than just physical pleasure. It is about our identity, our connection to ourselves and to others, and our very sense of vitality. According to the Cleveland Clinic and a host of other leading medical institutions, the practice of regular intimacy, and especially when it is paired with a deep and consistent practice of emotional self-care, can be instrumental in helping to regulate our mood, to reduce our levels of anxiety, and to preserve our cognitive function as we age. Here is why this is the case. Your brain actively responds to the experience of touch and of arousal with a powerful and beneficial release of neurotransmitters that directly promote our sense of well-being. These include serotonin, which works to stabilize our mood, and oxytocin, which helps to reduce our feelings of isolation and to foster a sense of connection. These are not just feel-good chemicals. They play an absolutely essential and indispensable role in keeping you emotionally resilient and mentally sharp. When these crucial neurochemical signals are missing from your life for long and extended periods of time, the effects can often mimic or even worsen the symptoms of depression, and this is especially true for women who are already navigating the major and often challenging life transitions of retirement, of the loss of a spouse, or of significant changes in their health. Let me share with you the story of a wonderful woman named Gloria. She was 69 years old when she first came to see me. She had been widowed for nearly a decade, and she had meticulously built for herself a very quiet and structured life. She was eating well, she was walking on a daily basis, and she was volunteering twice a week at a local organization. But on an emotional level, she told me that she felt like a hollow shell. "I smile for everyone else," she said to me, her voice thick with unshot tears. "But inside, I just feel completely gray." Gloria had not touched her own body with any sense of loving intention in many, many years, not out of a sense of shame, but simply out of a deeply ingrained habit of neglect. She had just simply stopped. Together, we began to work on the gentle and gradual process of rebuilding her sense of body awareness, starting not with the goal of physical pleasure, but with the very basic and foundational practices of relaxation and of emotional self-touch, such as placing a hand over her heart or engaging in some deep and calming abdominal breathing. Slowly, she began to reconnect with herself, and that profound and beautiful reconnection did not just serve to revive her on an emotional level, it also reawakened her very sense of purpose in life. She started taking art classes again, she began to dress with more flair and with more color, and she even started to laugh more fully and more freely. She told me, "I feel like myself again. For the very first time in so many years, I share these deeply personal and powerful stories with you because I want you to understand something that is absolutely vital. The practice of intimacy is not about a sense of indulgence. It is about the fundamental and essential practice of maintaining the intricate and delicate chemical, physical, and emotional systems that are responsible for helping you to feel whole. And you absolutely do not need a partner in order to start this beautiful and life-affirming journey of reconnection. A gentle and consistent practice of self-care, whether it is through the simple act of breathwork, through the practice of pelvic health exercises, or yes, through the art of mindful and loving self-touch, can serve to spark a quiet yet incredibly powerful and transformative shift in how you feel about your own body, about your day, and about your very place in the world. The path to reconnection, a gentle re-entry. Now that we have explored in great detail why the practice of staying connected to your own intimate health matters so profoundly, physically, hormonally, and emotionally, let us now talk about what you can actually and practically do about it. Because here is the wonderfully and profoundly encouraging news. Even if it has been many months, many years, or even many decades since you have last engaged in any form of self-intimacy, it is never, ever too late for you to begin again. The human body, and especially the female body, possesses a truly remarkable and magnificent ability to respond to our loving care and to our dedicated attention, no matter what our age may be. Let us begin with the absolute foundation, the restoration of your blood flow. As we discussed in great detail earlier, your delicate vaginal and clitoral tissues are made up of a complex and intricate network of very fine blood vessels and highly sensitive nerve endings. Just like the muscles in your legs or the joints in your hands, these precious areas of your body need a healthy and consistent supply of circulation in order to stay fully functional. When you go for too long without providing any form of stimulation to these tissues, that vital circulation inevitably and predictably slows down over time. This can lead to a state of thinning, of dryness, and even to a significant and often distressing loss of your natural sensitivity. But you absolutely do not need to jump straight into anything with which you are not completely and totally comfortable. For a great many women, the very first and most important step is simply a process of gentle and gradual reintroduction. You can start with something as wonderfully simple as a warm and relaxing bath, some soft and soothing music, or the gentle and loving practice of moisturizing with a high-quality pH-balanced vaginal cream. There are many excellent over-the-counter options available, such as vaginal moisturizers or, if they are approved by your personal doctor, vaginal estrogen creams, all of which can be of immense help in providing support for the natural elasticity and the healthy hydration of your tissues. And please, I implore you to remember, this is not about a sense of pressure or of performance. It is about giving yourself the precious gift of permission. You are absolutely and completely allowed to explore your own magnificent body with a sense of profound kindness. You are allowed to do so slowly and at your own pace. Even the simple and loving act of placing your hand gently on your own abdomen or over your heart as you breathe deeply can begin the beautiful and sacred process of establishing that fundamental sense of connection. Over the course of time, and if and when it feels right to you, you might then begin to explore the sensation of light and gentle touch, either by using your own hands or by utilizing a safe and gentle device that has been specifically designed for the unique needs of older women. Devices that have low and gentle vibration settings and that have soft and rounded edges are often much more comfortable and are far more effective for the purpose of gently stimulating your blood flow without causing any undue irritation. You may also want to try incorporating the use of a high-quality, water-based lubricant. According to the North American Menopause Society, this can be instrumental in helping to reduce any friction and discomfort that you might experience during the process of self-touch, thereby making the entire experience much more enjoyable and safe for you. The absolute key to this entire process is consistency, not intensity. Even the simple and gentle act of engaging with your own body just once or twice a week can make a truly significant and palpable difference in your ability to maintain your nerve responsiveness and the overall health of your tissues. And when your body feels as though it is being lovingly and consistently cared for, your mind and your spirit will very often follow suit. Now, let us talk about the important and empowering practice of strengthening the muscles that you cannot see, but that you will most definitely feel when they are not working as well as they should be, your pelvic floor. These are the very muscles that are responsible for providing foundational support to your bladder, to your bowels, and to your uterus. As you continue to age, the natural shifts in your hormones and a general state of inactivity can cause them to weaken over time. But the wonderfully good news is that these particular muscles respond absolutely beautifully to regular and consistent movement. Kegel exercises are the most common and the most clinically proven method for improving the strength of your pelvic floor. If you are not familiar with them, here is how you can try it. First, I want you to imagine that you are trying to stop the flow of your urine midstream. That gentle and internal squeeze that you feel, that is your pelvic floor activating. Second, you will want to hold that gentle contraction for a count of 3 to 5 seconds, and then you will completely release it. And third, you should aim to perform 10 of these repetitions, 3 times per day. If you are not sure that you are doing it correctly, please do not worry. You are certainly not alone in that. A great many women find that they benefit immensely from a consultation with a specialized pelvic floor physical therapist. These highly trained and compassionate professionals can expertly guide you through a series of gentle and effective techniques to help you to engage those crucial muscles in a safe and effective way, often in combination with specific and targeted breath work and with minor but important corrections to your posture. And, as we mentioned earlier, the experience of orgasm itself causes a series of rhythmic and involuntary contractions of the pelvic floor. So, when you choose to engage in the practice of self-intimacy, you are naturally and effectively strengthening those very muscles, you are enhancing your circulation, and you are providing valuable support for your bladder control, all without ever having to set foot inside a gym. Now, let us briefly return to the important topic of your hormone health. While it is true that your levels of estrogen, of progesterone, and of testosterone will all naturally decrease with age, that most certainly does not mean that you are powerless in this regard. The practice of regular sexual activity, and this very much includes the act of self-stimulation, has been conclusively shown in a variety of studies that have been published in esteemed journals like Menopause and Climacteric to provide valuable support for your body's own natural process of hormone regulation. That is because your brain actively responds to the experience of arousal and of orgasm by releasing a powerful and beneficial cocktail of hormones that are responsible for promoting a sense of relaxation, of connection, and of mood stability. It is, in essence, a beautiful and intelligent feedback loop. The more consistently you are able to activate those particular neurochemical pathways, the more likely your body is to maintain its innate ability to produce and to effectively utilize those beneficial and life-affirming chemicals. For women who may be dealing with the challenges of chronic anxiety or of significant and unpredictable mood shifts, the simple act of adding this kind of natural hormone, supporting routine to their lives, even for just 10 minutes a few times a week, can make a subtle yet incredibly powerful and positive impact. But beyond the realm of pure biology, there is another profound benefit to this practice that is just as, if not more, important: the sense of ownership. When you take the time to consciously and lovingly care for your own body in this deeply personal and intimate way, you are sending a powerful and affirming message, not just to your cells, but also to your very spirit. It is a message that says, I still matter. I still deserve to experience pleasure. I still belong in my own skin. I once had the privilege of working with a wonderful 76-year-old woman whose name was Denise. She had been widowed for a period of 15 years and had not even considered the idea of self-touch since her beloved husband had passed away. Her general health was fine, but she felt completely and utterly numb. And she was emotionally disconnected from her very identity as a woman. Through a process of gentle encouragement, of education, and of deep emotional support, Denise began the courageous journey of exploring her own body again. At first, it was admittedly quite uncomfortable for her, not on a physical level, but on an emotional one. She had to work through a lifetime of accumulated guilt, of deep and profound grief, and of decades of ingrained and often harmful cultural messages. But after just a few short weeks, she told me, I did not even realize how much I had missed myself. That one single and profound sentence says so very much, because this journey is not just about preventing a state of dysfunction or about boosting your hormones. It is about the sacred and beautiful process of self-recognition, of reconnecting with the parts of yourself that may have gone quiet over the years, but that are still very, very much alive. So, where do you begin on your own personal journey of reconnection? Here is a simple and gentle weekly routine that you might consider as a soft and loving entry into this beautiful and essential practice of self-care. On day 1, You could start with just 5 minutes of simple and calming breath work, with your hand resting gently and lovingly over your lower abdomen. On day 2, you could treat yourself to a warm and relaxing bath, perhaps with some soft and soothing music playing in the background, and engage in some simple and mindful touch with no agenda other than to be present with yourself. On day 3, you could practice your Kegel exercises while you are either seated or lying down, aiming for 3 sets of 10 repetitions. On day 4, you could take the time to lovingly moisturize your vaginal area with a doctor-approved and high-quality product. On day 5, you could, if you feel comfortable, engage in some optional and light self-touch, perhaps with the aid of a good lubricant or a gentle and safe device. On day 6, you could dedicate some time to rest and to deep reflection, perhaps by journaling, by meditating, or by speaking some gentle and loving affirmations aloud to yourself. And on day 7, you could simply repeat whatever part of this routine felt the most meaningful and nourishing to you that week. Even if you are only able to do half of this, please know that it is the consistency of your practice that truly and deeply matters. And please remember, nothing here has to be done alone. If you have a partner, a therapist, or a trusted and loving support network, I encourage you to include them in your journey. Your health and your happiness are so incredibly worthy of being shared with those who will respect and honor them. In our final part, we will bring everything together and we will talk about the most silent but also the most life-changing and profound impact of all. How this deeply private and personal decision to reconnect with yourself can affect your very identity, your relationships with others, and your fundamental sense of meaning in the world. Because the profound truth of the matter is that this is not just a simple medical issue, it is a deeply and profoundly human one. And you deserve every single chance to feel completely and utterly alive, both inside and out. Conclusion: reclaiming your identity and your aliveness. We have talked at length about biology, about hormones, and about muscles. We have talked about circulation, about mood, and even about the practicalities of our daily routines. But as we bring this important and intimate conversation to a close, I want to go even deeper, right into the very heart of what all of this really and truly means. Because what is ultimately at stake here is not just your physical health, it is your very identity. Too many women in their 60s, their 70s, and beyond quietly and gradually begin to feel as though they are fading into the background of their own lives. This does not happen because they are sick, and it most certainly does not happen because they have done anything wrong. It happens because they have, over time, let go of something that is absolutely essential to their being, their innate and profound sense of aliveness. Over the past 3 decades, I have sat across from hundreds and hundreds of women who have all expressed some version of this same heartbreaking sentiment. I do not know who I am anymore, they will say. Or, I just feel so invisible. Or, most poignantly of all, I simply miss me. And when we begin the gentle and compassionate process of unpacking those deep and powerful feelings, it very rarely comes down to a specific medical diagnosis. More often than not, it is the direct and cumulative result of many years of a profound and pervasive disconnection. A disconnection from pleasure, a disconnection from confidence, a disconnection from self-touch, a disconnection from joy, and a disconnection from the very parts of themselves that they were so often taught to suppress once they had hit a certain age. It is completely and totally understandable. For many generations, women were told that after the transition of menopause, the experience of intimacy was no longer a necessary or even an appropriate part of their lives. That a graceful woman, and more importantly, a good woman, was one who quietly and gracefully let that part of her life go. But I am here today to tell you that this is not just an outdated and harmful narrative. It is a lie. Science has now definitively proven that a healthy and active sexual life can and does continue well into our 80s and beyond. And more importantly, our lived and embodied experience tells us the same thing. I once had the privilege of working with a magnificent woman whose name was Margaret. She was 81 years old. She came to see me not because she was in any kind of physical pain or had any specific medical concern, but because she felt as though she had completely and utterly disappeared. Her beloved husband had passed away many years ago, and her children were all grown and had lives of their own. She had a beautiful garden. She was a member of a book club, and she had a lovely and supportive group of friends. But as she so eloquently and heartbreakingly told me in her own words, "I feel like I am just living from the neck up." She was not clinically depressed, and she was not physically ill. But something essential was missing from her life, and she knew it deep within her soul. We talked at length about the importance of body awareness, about the power of the breath, and about the beautiful and gentle process of reconnection. And for the very first time in over a decade, Margaret began the courageous journey of exploring her own physical self again. This was not for the sake of performance, and it was not for anyone else. It was a quiet and sacred act of her own personal healing. 3 months later, she told me, "Dr. Stones, I do not feel young again, but I do feel real again." That single and profound moment has stayed with me ever since. Because when a woman is able to truly and deeply reconnect with herself, she becomes so much more than just healthier, she becomes whole. This is not an indulgent act, it is a deeply and profoundly restorative one. It can restore your posture, it can restore the quality of your sleep, it can restore your relationships, and it can restore the very sound of your own voice. The women who begin the process of caring for themselves in this deeply personal and intimate way often begin to speak up more in their own lives. They begin to laugh more loudly and more freely, and they begin to wear bright and beautiful colors again. They walk through the world differently, and they are able to meet their own gaze in the mirror with a sense of love and of acceptance. That is not vanity, that is vitality. And I promise you, it is within your reach. If you are still reading or listening to this right now, I want to leave you with this final and heartfelt message. There is absolutely no age at which you are supposed to give up on the experience of joy. There is no birthday that makes you any less deserving of the experience of pleasure. And there is absolutely no expiration date on the beautiful and sacred connection that you have with your own body. You are not invisible. You are not past your prime. You are not done. You are evolving. You are adapting. And you are so completely and totally allowed to thrive. So, if you have been feeling distant from yourself lately, I lovingly and wholeheartedly invite you to begin the gentle process of coming back to yourself. Run your fingers slowly and mindfully through your own hair. Place your hands gently and lovingly on your chest as you breathe. Moisturize your beautiful skin slowly and with a sense of reverence. Whisper something kind and loving to yourself, and touch your own cheek as if it belonged to someone that you deeply and completely love. This is how we come back to ourselves. And if the idea of intimacy feels like a far-off and unattainable goal to you right now, please know that that is perfectly and completely okay. The process of reconnection is not a race. Every single small and loving act of self-respect and of self-attention counts. As we bring this series to a close, I hope that you feel encouraged, not just to understand the science that lies behind your magnificent body, but also to deeply and completely honor the beautiful and resilient spirit that resides within it. You have a fundamental and inalienable right to feel good in your own skin. You have a right to a sense of pleasure that is gentle, that is respectful, and that is deeply and profoundly affirming. And you have a right to age not just with a sense of good health, but with a sense of warmth and of wholeness. And if today's conversation has stirred something deep within you, if it has served as a gentle and loving reminder of a part of yourself that has been quiet for far too long, then I hope with all of my heart that you will let that beautiful part of you speak again. Because she is still there. And she is still you. If this series has helped you to feel seen and to feel understood, I invite you to please share it with a dear friend, a sister, a daughter, or anyone else in your life who might just need to hear that it is not too late. Not too late to reconnect, not too late to feel, and not too late to begin again. Thank you so much for trusting me with this important and intimate conversation. Please subscribe to Elderare Wellness for more thoughtful, compassionate, and evidence based guidance on the beautiful and complex journey of women's health after 60. And if you feel so moved, please leave a comment below, sharing your thoughts, your questions, or simply and powerfully that you are still here, you are still growing, and you are still honoring your magnificent body with love. Take such good care of yourself. You so deeply and completely deserve it.